The wife of the Anambra State Governor, Dr. Nonye Soludo, has called on mothers across the state to always go for routine vaccination of children to protect them from preventable diseases such as measles and rubella. Good day, viewers, and welcome to DDM Health News Updates. On our program, Your Health, Your Wealth. As usual, I often remind you guys to subscribe to our YouTube channel, that is Diaspora Digital Media, to get the latest on health. Well, the Lagos State Police Command has confirmed the death of a 60-year-old motorcycle operator, Wasio Aderina, who was swept away by floodwaters during heavy rainfall along the Lagos-Abeokuta Expressway in Alakuku, Lagos. So sad. In a Thursday statement signed by the State Police Public Relations Officer, Benjamin Hudein, the command revealed that the incident occurred on May 28, 2025, at about 4 p.m. Adeniran reportedly lost control of his motorcycle amid a downpour and was dragged by the raging flood. Oh my goodness. The unfortunate incident took place along the Lagos-Abeokuta Expressway, Alakuko, during heavy rainfall. If you can remember, this is what I've been warning about rainfall. Get prepared. The victim, Wasio Babatunde Aderina, fell off his motorcycle, which was also carried away by the flood. Wow. The statement read, "Effort to locate the victim began immediately, with Aderina's motorcycle located downstream around 6 p.m. on the same day. However, his body remained missing until the next morning." Oh. The body was discovered at about 9 a.m. on May 21, 2025, at the Obasanjo River in Ota, Ogun State. Hudein confirmed. Police detectives promptly visited the scenes of the incident and recovery, documenting evidence to aid their investigation. Photographs of the deceased were taken and the corpse has been deposited at the public morgue for an autopsy. Well, investigation is in progress, as the statement added. The police command reiterated its commitment to ensuring a thorough investigation while extending its condolences to the bereaved family. My condolences to them too. Next, the wife of the Anambra State Governor, Dr. Nonye Soludo, has called on mothers across the state to always go for routine vaccination of children to protect them from preventable diseases such as measles and rubella. Soludo made the call during an awareness stakeholders engagement meeting and inauguration of the Measles Rubella Vaccine Introduction Advocacy held at the Governor's Lodge, Abia, Oka, on Thursday. emphasizing that vaccination will reduce childhood mortality, prevent long-term disabilities, and secure the health of future generations. I support that too. She described measles and rubella as highly contagious viral infections that have led to unnecessary suffering, complications, and even death among children, adding that with the introduction of the combined vaccine, there is now a powerful tool to change that narrative. Wonderful. The event also served as an avenue to introduce another round of the distribution phase of the Noyen's Healthy Living Path, a solution which the governor's wife said has proven to be another great intervention that has changed the nutritional history of Anambra State. She said, I am deeply honored to stand before you today for these two very important events, the inauguration of the measles rubella vaccine introduction advocacy in Anambra State and another distribution phase of Noyen's Healthy Path. These two programs are unique because they look out for the health, growth, and welfare of our children. As a mother, a woman, and a public health advocate, I am particularly moved by the significance of what we have all gathered here to identify with. It marks a critical step forward in our collective efforts to protect our children, the future of our dear state, from preventable diseases. Measles and rubella are highly contagious viral infections that have led to unnecessarily suffering, complications, and even deaths among our children. With the introduction of this combined vaccine, we now have a powerful tool to change the narrative, to reduce childhood mortality, prevent long-term disabilities, and secure the health of future generations. The Healthy Living Path, on the other hand, has proven to be another great intervention that has changed the nutritional history of Anambra State. I'm happy to describe this one as a solid milestone, one that will be remembered by humanity and time. Of course, we wouldn't have achieved the results without the effort of our dedicated health workers who ensure that the products got to the right persons. Thank you so much for your efforts and resilience, she added. While I am glad that we have recorded significant results in the process, I wish to appeal that we build on the current tempo and push more to cover more grounds. According to her, it is imperative to know that it is not just about administering vaccines, yes, but about building trust, spreading awareness, and ensuring that every parent, caregiver, and community leader understands the importance of immunization. She, however, called on parents, guardians, caregivers, community leaders, and religious leaders, and all other stakeholders in Anambra State to join hands to mobilize communities and protect the children through vaccination to prevent disease. Please, the earlier, the better. Next, the Lagos State government has penalized 580 nightclubs and restaurants for breaching indoor smoking regulations in 2024 as part of its drives to promote public health and enforce safety standards across the state. The Director General of the Lagos State Safety Commission, Lani Mojola, said this during the 2025 ministerial press briefing held at the Babaguda Katu Press Center, Alausa, Ikeja. He said the commission visited a total of 2,024 public places last year, out of which 580 establishments were sanctioned for indoor smoking infractions. Public smoking is not allowed, and there is a bill already in place to prohibit it. People are permitted to smoke only in designated areas within certain venues. Please take note. Smoking indoor is very risky. If you see people smoking in buses or enclosed spaces, report them immediately. Yes, this is a serious public health matter. Please do that immediately. Also speaking, he noted that the commission launched an indoor smoking campaign in 2024 to sensitize the public on the risks of secondhand smoking, which he said could lead to cancer and other serious health conditions. We need the media to help push the message that indoor smoking is not allowed. It is not. Yes, our campaign is simple. See it, say it, sort it, Modula stated. So please, indoor smoking is a very risk action. Don't take that. Please. Also speaking, addressing questions on the use of consultants by the commission, Modula explained that they were engaged to support the agency's work due to limited staffing. He, however, acknowledged that some consultants had engaged in unwholesome practices. We have bad eggs among them. 4 of them have already been sentenced for illegal activities. But as Lagos grows, we must find ways to manage capacity gaps, he stated. Also speaking at the briefing, the Commissioner for Special Duties and Intergovernmental Relations, Olubenga Oyerindin, outlined the key achievements of the Commission in the past years. Oyerindin stated that the Commission carried out extensive safety audits across thousands of construction sites, financial institutions, and manufacturing plants. So please take note. All these are very, very risky for your health and others. You can imagine someone having asthma in a bus and you're smoking. Do you think that person will survive? Definitely the answer is no. So please look out for your neighbor and also for yourself. In total, smoking is no good. It affects the organs of your health. I often say your health is your wealth. So please resist from that.
I remember learning in medical school that measles has fever and then those 3 C's, the cough, runny nose, and conjunctivitis, and then the rash comes later. But that looks like a lot of the different viral infections that I see in primary care in kids. I know the rash looks a little bit different, but until that point, I imagine it's pretty hard to tell measles from other viruses.
Not hard at all. When children come into our hospital, Children's Hospital Philadelphia, and there's a suspicion of measles, they ask older people like me to come down and take a look, because honestly, I can tell within 30 seconds whether somebody has measles.
And 1 in 5 kids with measles were hospitalized.
You're right. I mean, measles causes congestion, runny nose, and rash and pink eye. And the rash usually starts at sort of the hairline here and then spreads down to the face, the trunk, and then out to the arms and legs. And the rash is the so-called measles-like rash, but there are rashes that look similar. So you could argue, how do you distinguish fever and a rash in someone who has measles from fever and a rash and these other viral infections that can do the same thing? And the way that you do that is children with measles are sick. You can really tell within 30 seconds of walking in the room who has measles and who doesn't, because children with measles are miserable.
And then there are long-term complications from measles that we don't see with many routine childhood illnesses.
That's right. So measles causes the rash we all know about, but it also can cause severe and occasionally fatal pneumonia. Measles can also infect your brain. And every year in this country, before there was a measles vaccine, which was first available in the early 1960s, we would see 48,000 hospitalizations with measles, and we would see 500 deaths from measles. But there's one long-term complication of measles that I think few people know about, and it has the fancy name subacute sclerosing panencephalitis. And that's just a progressive neurological degeneration. Initially, it starts as sort of poor handwriting, and then eventually and invariably progresses to death. And once that symptom cascade starts, it's inevitable that it's a fatal outcome.
But the measles vaccine is a live vaccine, so I would imagine that some parents would worry that they could have that SSPE complication from the vaccine. We don't see that, though.
No, the key is not just live, it's live attenuated. So it is a highly, highly weakened form of the virus. So it induces the immunity that's a consequence of the natural infection without having to pay the price of natural infection. And it worked. I mean, measles is the most contagious of the vaccine preventable diseases. I mean, if someone comes into our hospital and they are into one of the rooms in the emergency department, no one can go in that room for another 2 hours until all those tiny little droplets settle. But nonetheless, we were able to eliminate measles from this country by the year 2000. Unfortunately, measles has to some extent come back because a critical number of parents have chosen not to vaccinate their children.
The contagiousness is what worries me the most. As a primary care doctor, as you mentioned, it hangs out in the air for a while. And if you're not vaccinated and you're in the same space as someone with measles, 9 out of 10 of those people will contract measles, which is unlike any other infection that's in my waiting room, which is so scary because there have been periods in time where many people are not getting the measles vaccine. And we see outbreaks even in the US because people travel.
You're right. It's frightening. I take a disease like smallpox, which was fatal 30+% of the time, but that was spread by large droplets. You really need to have face-to-face contact with someone with smallpox to get that disease. For coronavirus, for this virus, the COVID virus, it's generally small droplets. So again, you need to be fairly close to somebody who has that virus and then is spreading it by talking or sneezing or coughing. Measles is spread by aerosol. So it's very, very tiny droplets that can hang in the air like a ghost before they settle down. And that's what makes that virus so remarkably contagious.
In 2019, we saw some of the highest rates of measles in the United States since the early 90s. And we think that some of that is due to people refusing the vaccine. During the pandemic, though, with social distancing, we were distancing and we didn't see measles, thankfully. But I do worry that as we start coming back together again, that we might see measles coming back.
Oh, I think you're right. I think what worries me actually is that because of this pandemic, children have become under-vaccinated for a variety of potential infectious diseases. And I really do feel that as we all now get back together again and unmask and don't social distance, that you're going to see some of these vaccine preventable diseases come roaring back in that group that is unvaccinated.
And you're right that we forget about how serious measles is because many people who were born after the vaccine haven't seen it. And it does feel like something that was just in a textbook. But as you mentioned, these kids get so sick that it's something that we can't forget about.
Well, with this, we come to the end of our news today on Your Health, Your Wealth. Don't forget to like, share, comment, and subscribe to our YouTube channel. That is Diaspora Digital Media, popularly known as DDR. Until next time I come your way, I am Nenyere Michael Nezini. Do have a wonderful day ahead. Thanks for watching. Bye for now.